Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what you need to know about epidural injections. An epidural injection is an outpatient procedure that involves steroid and numbing medicine being placed into the epidural space. It's designed to relieve the pain from pinched nerves. The epidural space is the area around the spinal cord where the nerve roots come off. So these injections do not go into the spinal cord, they go around it. Epi means around. Dura is actually the name for the covering of the spinal cord, the dural sac. The injection, as mentioned, does not go into the spinal cord, and it also does not go into the nerve roots. The indications for an epidural injection includes a herniated disc with radiculopathy or sciatica. So sciatica is specifically referring to the lower back, and then radiculopathy could be the neck, the mid-back, or the low back. Spinal stenosis is another indication for an epidural injection where nerves are getting pinched due to overgrowth of bone and soft tissue from arthritis. Also, if you have a tear in the outer part of a disc, this is called an annular tear. It can spark up pain and inflammation that can affect an adjacent nerve root. So this can be a great indication for an epidural. And then compression fractures. These fractures can spark up pain resulting from inflammation around thoracic intercostal nerve root or whatnot. So that can be very helpful in those situations. There are 3 different types of epidural injections. The initial one was done back in the 1950s, so it's been over 60 years that these procedures have been done. The one that was first invented was called an interlaminar epidural injection, and you can see that here. Basically, here's a spinous process. You can feel these bumps on the back of your skin. This is the sacrum, so you're at L4-5 here. But basically, this is a lamina. This is a lamina. This is the interlaminar space, so the doctor will put a needle through the soft tissue here and go interlaminar. When they get through the initial soft tissue, they'll feel a loss of resistance, and then that's where the epidural space is. Modern pain management doctors will use fluoroscopy or some kind of imaging like ultrasound, so they know exactly that they're in the right space. Transforaminal is the newest type of epidural injection. What you can see here is that here is where an interlaminar would have gone, okay? But with the transforaminal, what you're doing is the pain doctor is putting the medication very close to where the nerve root is actually being pinched, okay? The nerve roots come out from these holes. These are called foramina. So the needle goes close to the transforaminal area. Usually the disc is pushing out here and pinching the nerve root, so you're really getting close to where the nerve root's actually getting pinched, and these injections work wonderfully. A caudal epidural injection is a whole different animal, so to speak. You have your lumbar spine, your sacrum. There's an area here called the sacral hiatus. It's an opening. That's where the needle goes. Okay, and the pain doctor will inject a much higher volume of numbing medicine and steroid medication. The medication will migrate up and be able to relieve the pain from multiple nerve roots getting pinched. So it's a great injection for spinal stenosis. These are outpatient injections, usually about half an hour. Local numbing through the skin is used in soft tissues. Sedation may be administered as well. Real-time x-ray, such as you see here, this is called a C-arm. It's in the shape of a C, and it shows up here as real-time x-ray. The interlaminar, as mentioned, uses a loss of resistance technique with dye being injected to make sure that the positioning is accurate. Patients go home the same day after the procedure, usually about an hour later. How well do the injections work? Dozens of studies have been performed looking at epidural injections. 75 to 90% good to excellent results is what typically is seen in the best studies. It may need a series of 3 injections over a 6-week period for maximum benefit. If the first one works really well, then that's all you need for the time being. If the first one works okay, it may be that the second and third are indicated to give the maximum relief. The numbing medicine is going to work right away, and it may take the steroid medication 1 to 3 days to truly kick in. And it can last anywhere from a few days to a few months. Now, before we talk about the risks of epidurals, I just want to give an overview. These injections don't fix anything. They don't make a herniated disc unherniate. They don't make a spinal stenosis situation, cure itself. They're a proverbial Band-Aid, all right? They're a great Band-Aid, but they don't fix anything. The risks of epidurals are less than 1%, and they include infection, bleeding. Non-steroidals should be stopped, 5-7 days prior. allergic reaction, maybe temporary side effects of the steroid, such as blood sugar issues. Rarely, you can get a nerve injury. The biggest risk is that they might not work, and then you can get a second or a third one, but it still may not work. Are epidural injections FDA approved? They are not FDA approved for use in the spinal canal. They are not unapproved for use either. So this is not a bad thing. 40% of medications are used off-label all the time. It's legal. It's beneficial. Here's some examples. Neurontin. It's FDA approved as an anti-seizure drug. That's its label, but it's used off-label for nerve pain and migraines. It works very well, and the drug company just hasn't felt like putting the tens of millions of dollars into doing a study to get it on label for these other indications. Lidoderm is approved as an FDA skin patch for shingles pain. It's used all the time off-label for back pain and other numbing needs. Okay, propranolol is FDA approved for high blood pressure. The top pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The board-certified award-winning pain doctors exceed a 90% average success rate. Visit us online today at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.